This is going to be a DocuCare introduction and how we're going to utilize DocuCare in first semester here. So DocuCare represents an electronic health record. All the hospitals that we go to, whether you're at Oroville, Rideout, or at Enloe, all use their own form of an EHR. This is what we're going to use in Skills Lab and in simulation to mimic that, to get you guys that real world experience. So first, you'll have patients that will be assigned to you, and those will be, some will be practice patients for when we do our competencies, for example, med administration. Others of them will be your actual competency patients. So just an overview of what it looks like. So this one would be Alan Covey. So that's the patient. You just click on it. And then you have all this kind of information. And again, this is for some of you, maybe you've never seen what a patient's chart looks like on the computer. So this is a version of what this one would look like, very similar to what they look like at Enloe and close to what they look like at Rideout as well. A little bit different at Oroville, but very, you'll get the basic idea. So at the top, you have the name. And then you have your different allergies. And so we always want to know our patient's name, date of birth, right here, and then their allergies, right? Those are our safety precautions we always check when we go and meet our patient. So you want to be identify those things on your chart. You have your diagnosis up here. You also have isolation precautions. If they were, in contact isolation, you'd want to note that so you can make sure that you put on the proper protective gear before you go into the room. And then the one thing I want to mention too is anytime you see this little green stethoscope, that means you can click on that and it's going to give you more information. So let's say you're unfamiliar with this person's diagnosis. You can click on that. It's going to pop up in a new window and it's going to go ahead and give you all kinds of information on that that patient's diagnosis. So specifically pneumonia, it talks about risk factors, complications, history. And then if you want to skip anything you want, what kind of nursing interventions, what I need to do with this patient. And it gives you a bunch of different things. So it's very helpful. So anytime you see that green stethoscope, go ahead and click on that. So beyond the name, date of birth, and allergies, you want to look under here and you have all these represent different little tabs. So right here, we're under patient info. You have your assessment, ADLs, notes, plan of care, teaching, orders, MAR, which stands for medication administration record, INO, vital signs, diagnostics, OT. These are all things that you're kind of going to want to specifically check out in regards to your patient. So you're like I said, we're going to use this in simulation, for example. And so when you're in the nurse for that patient, you're going to want to go ahead and check this out. So let's go ahead and check the notes out and see if there's any notes about anything. So here, this says, it's very brief. Sometimes they're much more lengthy than this, but we have Alan Covey called the nursing asking if he can have medication for his anxiety. It's currently 1400 and signed by Dr. Burton, the admitting physician. Okay, so we know it's 1400 and we know that Alan's complaining some anxiety. So then we might want to go over to the MAR and then we can look at their medications. So we have all these medications here. And then we can look to see if they have anything that is due for anxiety. This medication right here is an anxiety medication. And when we look under notes, it tells us that it's every 4 hours. We know it's PRN. We have the dose over here of 0.25 milligrams. And it's every 4 hours PRN for anxiety. And then we know it's not previously administered. This tab right here where it says due at, you do want to ignore that tab on this electronic charting because the students, we all log in at different times. And so if one student gives it in the morning and then the afternoon class gives it again, it messes up the times. So any time that's involved, it'll say right here, it'll say under notes. Like for example, this Caterpillar medication, hold if systolic blood pressure is less than 90, give at 8 a.m. So that's when you know what time it is. And you're going to know what time it is based upon what's in the notes section here. Okay. And again, we know it's 1400 because it says it's so in the notes. So when I go back to my MAR, let's say I want to find out some more information about this Xanax med. Then I click on that green stethoscope and it's going to give me all that information that's in a drug book, right? We're never going to give a medication unless we have all the patient education that we're going to give to the patient, but also the medication that we're going to need as a nurse to do our proper assessments pre-giving the medication and post-administration as well. So we want to go through and kind of read all this and figure out all the important facts on that. Okay, specifically, you definitely want to pay attention to anything that's black box warning or bolded or in red as well. Okay, so that's how that's the green stethoscope works. And then if you're actually going to give the medication, you go ahead and click on administer. And then it's going to bring up the dosage information. You're going to click patient drug dose that you confirmed all those things, and etc. And you're going to want to scan the patient, do all that stuff. You're going to want to watch that video on the competency video that's on the YouTube channel. That'll direct you on how that whole process actually works. This is just more of an overview of the charting system. So if we're not dealing with meds, we want to check our patient's orders to see what else the patient has ordered. So we have an echocardiogram, we have a 12-lead EKG. Again, maybe you don't know what the EKG really is, so you click on the green stethoscope and it brings that information up to enhance what that's for, and then little bit about heart rhythms and whatnot. So it's very helpful, and it tells you, you know, where you're supposed to place the leads, which is very helpful if you're unfamiliar with that as well. And so you just continue to look at all this information and make sure that you're following all the orders that have been given by the doctor. If you're also going to want to look for the patient's diet, right? Because we want to make sure that they're not NPO, meaning nothing by mouth. So it's okay to give them water when they take their pills, that sort of thing. So all that would be in this orders section. Okay. The other thing I wanted to mention too is specifically when we're in simulation, you might have what's called a protocol, and that'll make sense when we talk about oxygen protocols or a blood glucose hypoglycemic protocol. They're all going to be under here, under this view attachments tab. So you'll want to, right now there's nothing attached here, but in future, when we get to simulation, there will be an attachment here for the oxygen protocol. Those are orders that we can follow as well that aren't built into this system, but they're built into the simulation. So you'll want to check that as well. If you want to check the patient's previous vital signs, you just click on the vital signs tab. Again, these are all tabs here. And these are the previous, gives you the times, etc. And then if maybe you took vital signs, let's say in simulation, then you can go ahead and add new vital signs here. Blood pressure, location, cuff, that stands for lower upper extremity, right upper extremity, cuff, left forearm, etc. Heart rate, beats per minute, respiratory rate, etc., etc. Make sure you save it after you put it in, and then it'll pop up as new. The other thing you want to make note of is diagnostics. These are going to be labs. So it looks like the patient had a CBC, complete CBC here. And so here's your values. You have hemoglobin, hematocrit, platelets, white blood cell count. And here's your results. And it's going to tell you if they're normal, low, or high. And then you have your reference range over here. Okay, so you'd want to investigate that as well. There's also this other tab right here that says other diagnostics. So it looks like this patient has had an EKG and an X-ray done already. So again, this is information that you'd want to do before you go and view your patient in simulation or a practice patient in skills lab. So you look at this, it tells us an EKG was done and it says it was normal. And then it gives us the reading. So if we pop that up, then we can look at that EKG that the patient had done. If we click back and let's say we wanted to check out that chest x-ray, again, I'm on this other diagnostics tab. Looks like we have a chest x-ray, congestion and cardiomegaly, and then we have the x-ray here that we could check out as well. And then if you wanted to check out the other labs, looks like they had a BNP done and a A1C done here as well. So you could check out those. These are just a few other things as well. Patient teaching, if you charted patient teaching, you could put that here. Plan of care. If you needed help with your nursing NANDA diagnosis, then you can click on this care plan using NANDA. And let me do skin. then it said, okay, so now they have skin issues. So now we can use impaired skin integrity or risk for impaired skin integrity. Okay. And then we want it to be an actual diagnosis and then physiological. Okay. And then it lets us chart a little bit more, continue on down, continued, and then helps us with our goals, with our outcomes. And then it even gives us nursing interventions for us to click. Okay, we're going to monitor, instruct skin as appropriate. We're going to provide skincare every 2 hours, etc. Bunch of different things. And this is our evaluation of it as well. Here's your assessments. So if you were asked by your instructor to go ahead and chart your, let's say you did a respiratory assessment in simulation, your instructor asked you to go ahead and do charting on that, then you're gonna go ahead and chart everything that you did. So if we go down, here is our breath sounds. Okay, right here we're doing right upper lobe. It was clear. Right middle lobe was clear. Right lower lobe was clear. The left lower lobe, though, I heard some wheezing. So I'm going to click wheezing. Left lower lobe, also some wheezing. And then here, respirations were regular. Sputum, they didn't cough anything up. None. Respiratory, none of this is there. And then I'm going to click none. Okay. And then you can continue on. It's very detailed, just like it is in the hospital. And then if you wanted to do another system, maybe you did a pain assessment, you can start doing your pain score. You can do your skin, mental health, muscular, skeletal, all that stuff charting is all in here. And this is exactly what is occurring in the hospital. The nurses are charting by click boxing, or in this case, clicking the little circles. So again, that's kind of the overview of DocuCare and how we're going to be using it in first semester simulation and in skills lab and going forward. So again, the important things again are your name, your allergies, your date of birth, and your diagnosis. And then you want to make sure that you check your patient's notes to figure out what's going on with the patient, so you're updated. Then you can also click on their orders and review those. Here's your medications that they would give, your intake and output, your vital signs, your labs under diagnosis. So these are all tabs for you to click on. So that's going to be an overview of your DocuCare. If you have more further questions than this video, and then also what your instructors provided in class, please reach out to one of us and we will be more than happy to assist you.